come with yet another important topic talking about drugs or pharmacology. Our concentration today will be drugs that are used within the central nervous system or central nervous system stimulant. Okay, so we're looking at drugs of the CNS, okay, or drugs that work within the central nervous system. So we'll be abbreviating central nervous system within our discussion as CNS. So let us now look at the drugs affecting the CNS. Drugs acting on the CNS may be CNS depressants or CNS stimulant. They may depress, meaning reduce activity, or they may try to increase stimulant. Depressants are more important pharmacologically and therapeutically than stimulants. Most drugs that affect the CNS act by altering some step in the neurotransmission process. Drugs affecting the CNS may act presynaptically by influencing the production, storage, release, or termination of action of neurotransmitters. Other agents may activate or block postsynaptic receptors. However, we'll discuss prototype drugs that are used in different CNS-related diseases. So one, we're going to look at neurodegenerative diseases as a disease for which CNS drugs will be used. Anxiolytic and hypnotic drugs. We're going to look for drugs that are used in treatment of anxiety as a condition. Then we'll look at CNS stimulants. We'll look at drugs that can be used in depression, antidepressants. We are going to look at neuroleptic drugs, and we'll also look at anti-epileptic drugs. So to start this lesson, let us look at neurodegenerative diseases and some of the drugs that can be used in such conditions. So anti-Parkinson drugs can be used in neurodegenerative disease because Parkinson disease is a neurodegenerative disease. Neuro from the neuron. Okay, so as someone is aging, they may develop Parkinsonism. So one of the drugs that can be given in a neurodegenerative disease include Levodopa. Levodopa is a metabolic precursor of dopamine. So it's a precursor, more like an inactive form of dopamine that needs to be activated so that we have the needed dopamine. It decreases the rigidity, tremors, and other symptoms of Parkinsonism. Because Parkinsonism results from insufficient dopamine in a specific region of the brain, attempts have been made to restore the dopamine deficiency. So we are saying Parkinsonism comes because of dopamine insufficiency. So we give a precursor, okay, more like an inactive form of dopamine, so that when it is in the body, it's activated to become dopamine. So for the dopamine, so levodopa. Mechanism of action. Dopamine itself does not cross the blood-brain barrier, but its precursor, levodopa, is actively transported into the CNS and is converted to dopamine in the brain. So that is why we're saying it's a precursor. So it will cross the blood-brain barrier, the BBB blood-brain barrier, and it will be converted into dopamine. Therapeutic uses. Levodopa in combination with carbidopa is currently available to treat Parkinson's disease. It reduces the severity of the disease for the first few years of treatment. Pharmacokinetics. The drug is absorbed rapidly from the small intestine. The Levodopa should be taken on an empty stomach. Levodopa has an extremely short half-life of about 1 to 2 hours. Adverse effects. In the peripheral effect of the adverse effects seen in levodopa include tachycardia, nausea, vomiting, hypotension, brownish color of saliva, and urine. CNS effects. CNS effects include abnormal important movement, mood change, depression. Let us now look at anxiolytic and hypnotic drugs. So under anxiolytic and hypnotic drugs, we have benzodiazepines. We also have barbitulates, and then we have other anxiolytic drugs. So an example under barbitulates include phenobarbital, and on other anxiolytic drugs or anxiety drugs include buspirone. Benzodiazepines. Benzodiazepines are the most widely used anxiolytic drugs. These are safer and effective than others like barbitulates. Mechanism of action of benzodiazepines. The targets of benzodiazepines action are GABA receptors. GABA for gamma aminobutyric acid. Benzodiazepine modulates the GABA effect by binding to a specific site. These binding sites are sometimes labeled benzodiazepine receptors. Action of benzodiazepine on the reduction of anxiety. At low dose, the benzodiazepines are anxiolytics. They reduce anxiety by selectively enhancing GABAergic transmission in neurons. Their sedative and hypnotic action. Benzodiazepines also have sedative properties, and some can produce hypnosis. Artificially producing sleep is hypnosis. So if given at higher doses, they may produce hypnosis as a muscle relaxant. At high dose, a benzodiazepine relaxes the skeletal muscles. Therapeutic uses. Therapeutic uses include treatment of anxiety. Benzodiazepines are effective for the treatment of anxiety disorder, social anxiety disorder, performance anxiety, and the likes. The drug should not be used to reduce the normal stress of everyday life anxiety. They should be used for short period of time. Muscular disorders. The benzodiazepine may be used in muscular disorders. These agents are useful in the treatment of skeletal muscle spasms. Therapeutic use in seizures. These agents are also used in treatment of certain types of epilepsy. Treatment, therapeutic use of sleep disorders. Not all benzodiazepines are useful as hypnotic agents. Although all have sedative or calming effects, these agents are also used in treatment of insomnia. Pharmacokinetic. Benzodiazepines are lipophilic and they are rapidly and completely absorbed after oral administration and distributed throughout the body. Adverse effects. Adverse effects include drowsiness and confusion. Early morning insomnia may also be noticed. With benzodiazepines are discussed, let us now look at the barbiturates. Mechanism of action. The sedative hypnotic action of barbiturates is due to their interaction with the GABA receptors, which enhances GABAergic transmission. Action. Depression of CNS. At low dose, the barbiturates produce sedation. They have a calming effect and reduce excitement. At higher dose, the drug causes hypnosis, followed by anesthesia, leading to loss of feeling or sensation, and finally coma and death may result. Thus, any degree of depression of the CNS is possible depending on the dose. So, barbiturates can be used in the depressing of the CNS, as at low dose, the barbiturates produce sedation. Respiratory depression as one of the action. Barbiturates suppress the hypoxic and chemoreceptor response to carbon dioxide, and overdosage is followed by respiratory depression and death. Therapeutic use of barbiturates. Anesthesia. Selection of a barbiturate or barbiturate is strongly influenced by the desired duration of action. The ultra-short acting barbiturates such as thiopentol are used intravenously to induce anesthesia. Barbiturates as anticonvulsants. Barbiturates are used in long-term management of seizures, status epilepticus, and eclampsia. Therapeutic use of barbiturates in anxiety. Barbiturates have been used as mild sedatives to relieve anxiety, nervous tension, and insomnia. Pharmacokinetics. Barbiturates are absorbed orally and distributed widely throughout the body. These agents are metabolized in the liver, and inactive metabolites are excreted in urine. Adverse effects. Some of the adverse effects seen after taking barbiturates include drowsiness, impaired concentration, and mental or physical sluggish tremors, anxiety, weakness, restlessness, nausea and vomiting. Death can occur due to overdose of many of these drugs. Buspirone on other anxiety agents. Buspirone is useful in the treatment of generalized anxiety disorder. Buspirone lack the anticonvulsant and muscle relaxant property. Most common adverse effects are headache, dizziness, and nervousness. With barbiturates discussed, let us now look at the CNS stimulants or central nervous system stimulants. Large number of drugs may stimulate different parts of the brain, and in large doses they may stimulate all parts of the brain. CNS stimulants have diverse clinical uses and are important as mostly seen as important as drug of abuse. Following prototypes of CNS stimulants include psychomotor stimulants, where cocaine and nicotine are some of the examples. Then we have hallucinogen like lysergic acid diphenamide, cocaine, which is a psychomotor stimulant. Cocaine is a widely available and highly addictive drug that is currently abused daily by more than 3 million people, also depending on the statistic in that part of the country. These drugs, according to the lesson that we had, are controlled drugs by Home Affairs. Mechanism of action. Cocaine inhibits the reuptake of monoamines, norepinephrine, serotonin, and dopamine. The inhibition of reuptake of monoamine by the cocaine potentiates and prolongs the CNS and peripheral action of these monoamines. Action on the CNS. The behavioral effect of cocaine results from powerful stimulation of the cortex and brainstem. It also causes tremors and convulsions. Action concerning hypothermia. Hypothermia can also be caused by cocaine. Therapeutic uses. Cocaine has a local anesthetic action. Cocaine is applied topically as a local anesthetic during eye, ear, nose, and throat surgery. Cocaine is the only local anesthetic that causes vasoconstriction. Pharmacokinetic. Cocaine has a local anesthetic action and can be applied topically. Now let us look at pharmacokinetics. Cocaine is often self-administered by chewing, intranasal, smoking, or intravenous. Onset of action is most rapid. For intravenous, onset of action is most rapid. Adverse effect. Some of the adverse effects of cocaine include anxiety, depression, seizures, cardiac arrhythmias. Nicotine as a psychomotor stimulant. Nicotine is the active ingredient in tobacco. It is most widely used as CNS stimulant. Mechanism of action. In low doses, nicotine causes ganglionic stimulation by depolarization. At high doses, nicotine causes ganglionic blockade. Action on the CNS. Nicotine is highly rapid soluble and rapidly crosses the blood-brain barrier. It improves attention, learning, problem solving, and reaction time. Peripheral effect or peripheral action of nicotine. The peripheral effects of nicotine are complex. It increases blood pressure and heart rate. Use of tobacco is harmful in hypertensive patients when talk of nicotine. Pharmacokinetics. Because the nicotine is highly rapid soluble and absorption readily occur via oral mucosa, lungs, GIT, and skin. Clearance of nicotine involves metabolism in the lung and the liver and urinary excretion. Adverse effect. Adverse effects of nicotine include high blood pressure, tachycardia, diarrhea, or tremors. Let us now look at hallucinogens. Okay, under hallucinogen, we are looking at lysergic acid diethylamide. Mechanism of action. Multiple sites in the CNS are affected by lysergic acid diethylamide. The drug shows serotonin agonist activity at a presynaptic receptor in the midbrain. Pharmacological effects. Activation of the sympathetic nervous system causes a pupillary dilation, increased blood pressure, and increased body temperature. Adverse effects of hallucinogen include hyperreflexia, nausea, and muscular weakness. Let us now look at antidepressants. Depression is a serious disorder and its symptoms are intense feeling of sadness, hopelessness, and inability to experience pressure in usual activities. Some of the prototype drugs that are used in depression may include selective serotonin reuptake inhibitor. An example here is fluoxetine. Then we have serotonin norepinephrine reuptake inhibitor. We have duloxetine. Then we have a typical antidepressant where we have mirtazapine. Then we have tricyclic antidepressant where we have Andriptrain. Then we have monoaminosis inhibitor where we have phenelzine. Let us now look at the selective serotonin reuptake inhibitors, fluoxetine. Selective serotonin reuptake inhibitors are a group of antidepressant drugs that specifically inhibit serotonin uptake. Mechanism of action. The serotonin selective reuptake inhibitor block the reuptake of serotonin, leading to increased concentration of the neurotransmitter in the synaptic cleft and increased postsynaptic neuronal activity. Therapeutic uses of SSRI or selective serotonin reuptake inhibitors. They are used for treatment of depression. It's also used for generalized anxiety disorder. They are also used in panic disorders. Pharmacokinetics. All SSRI are well absorbed after oral administration. All agents are well distributed. Their half-life range between 16 to 36 hours. Adverse effects: headache, sweating, sleep disturbance, and sex dysfunction. Let us now look at serotonin or norepinephrine reuptake inhibitors. And the example under this one is duloxetine. Duloxetine inhibits serotonin and norepinephrine reuptake at all doses. It is metabolized in the liver. Duloxetine should not be administered to patients with hepatic insufficiency. Metabolites are excreted in urine. Food delays the absorption of the drug, so it should be taken on an empty stomach. The half-life of the drug is 12 hours. Let us now look at another group of drugs and antidepressants, that is atypical antidepressants, mirtazapine. This drug enhances serotonin and norepinephrine neurotransmission via mechanism related to its ability to block presynaptic alpha-2 receptors. It does not cause the antimuscarinic side effects. Its increased appetite and weight gain may also be seen to frequently occur in patients taking mirtazapine. Mirtazapine has also got a sedative effect, which may be used in sleeping disorder. Let us now look at tricyclic antidepressants, and we are looking at the drug known as Andriptrain. Mechanism of action. Tricyclic antidepressants block serotonin and norepinephrine reuptake into the neuron. Tricyclic antidepressants also block serotonergic, alpha, adrenergic, histaminic, and muscarinic receptors. Action. Tricyclic antidepressants elevate mood, improve mental alertness, and increase physical activity. Therapeutic use. Tricyclic antidepressants are effective in treating moderate to severe major depression. Some patients with panic disorders also respond well to tricyclic antidepressants. Pharmacokinetic. Tricyclic antidepressants are well absorbed upon oral administration because of their lipophilic nature. They are widely distributed in the body. These drugs have variable half-lives from 4 to 17 hours, metabolism occurring in the liver and also excreted in urine. Adverse effects. Adverse effects of tricyclic antidepressants may include blurred vision, dry mouth, urinary retention, and constipation. Let us now look at another group of drugs under central nervous system drugs. Here we are looking at monoamine oxidase inhibitor, MAOIs, monoamine oxidase inhibitor. An example here is phenelzine. Monoamine oxidase, abbreviated as MAO. So now, since we're looking at the drugs, we're looking at inhibitors. I is mitochondrial enzyme found in nerve and other tissues. In the neuron, monoamine oxidase function a safety valve as monoamine oxidase inactivates any excess neurotransmission. Mechanism of action. Most monoamine oxidase inhibitors form a stable complex with the enzyme to increase the storage of norepinephrine, serotonin, and dopamine also within the neuron. Action. These drugs are used to inhibit the action of monoamine and enhance the activity of neurotransmitters. Therapeutic use. Monoamine oxidase inhibitors are used for the treatment of depression. Patients with low psychomotor activity may also use these agents. Pharmacokinetics. These drugs are well absorbed after oral administration. Monoamine oxidase inhibitors are metabolized and excreted rapidly in urine. Let us now look at adverse effects of monoamine oxidase inhibitor. Some of the side effects or adverse effects include headache, stiff neck, tachycardia, hypertension. Okay, so those are some of the common side effects. With monoamine oxidase inhibitor drugs discussed, let us now look at neuroleptic drugs or antipsychotic drugs. Neuroleptic drugs are used primarily to treat schizophrenia. They are also used in other psychotic states such as manic states. Schizophrenia. Schizophrenia is caused by increased dopamine activity in mesolimbic pathway and mesocortical pathway. During schizophrenia, glutamic acid activity in the brain is decreased, and now there is a new emergency of serotonin in the development of schizophrenia. Prototype neuroleptic drugs. So we have a typical neuroleptic, that is it, they have low potency. Then we have typical neuroleptics with a high potency. Then we have atypical neuroleptics. So some of the examples under typical neuroleptics with low potency include chlorpromazine. And then under typical neuroleptics with high potency include haloperidol. So when talking about typical antipsychotic drugs, we mostly talk about chlorpromazine and haloperidol. So chlorpromazine has got a low potency, whilst haloperidol has got a high potency. Then when we talk of a typical neuroleptic drug, we talk of clozapine, of which there are also other drugs. Okay, so now here is the general introduction of neuroleptic drugs, mechanism of action. Dopamine receptor blocking in the brain. All of the other and new neuroleptic drugs, they block dopamine receptor in the brain and the periphery. The neuroleptic drugs bind to these receptors in a varying degrees. Serotonin receptor blocking activity in the brain. Some of these drugs also inhibit the serotonin receptors action, antipsychotic action of neuroleptic drugs. All of the neuroleptic drugs can reduce the symptoms of schizophrenia by blocking dopamine receptors in the brain. Antiemetic effect of a neuroleptic drug. Most of the drugs have antiemetic effect. Emesis also may stop that feeling of abnormal feeling of more like vomiting. Antimuscarinic effect of neuroleptic drugs. Some of neuroleptic produce anticholinergic effects. Therapeutic uses. Neuroleptics. Let us now look at mechanism of action of these drugs. All of neuroleptic drugs can reduce the symptoms of schizophrenia by blocking dopamine receptor in the brain. Then they also have anti-emetic effect. Most of these, they may help to stop the feeling of vomiting. They also have anti-muscarinic effect. Some of the neuroleptics may produce anticholinergic effects. Therapeutic uses. Neuroleptics are considered to be the only efficacious treatment for schizophrenia. Prevention of severe nausea and vomiting. All the neuroleptics are useful in the treatment of drug-induced nausea and vomiting. So you find that if someone is taking anti-cancer drug, they may decide to use a neuroleptic drug to stop the excessive feeling of vomiting. Other uses. Neuroleptic drugs can be used as tranquilizers. These drugs with combination also used for treatment of chronic pain and severe anxiety. Pharmacokinetics. After oral administration, neuroleptic show variable absorption. These agents readily pass into the brain. Adverse effects. Movement disorder, tremor, constipation, urinary retention, confusion, and sexual dysfunction can be noticed if someone is taking neuroleptic drugs. Let us now look at anti-epileptic drugs. Anti-epileptic drugs. Epilepsy. In epilepsy, there is a sudden, excessive, and rapid discharge in the gray matter of the brain. Okay? Epilepsy is not a single entity, it is a collection of different seizure types and syndrome originating from several mechanisms. This abnormal electrical activity that occurs in epilepsy may result in a variety of events including loss of consciousness, abnormal movement, and odd behavior. Odd behavior as ODD behavior. So, odd behavior. Seizures have been classified into two groups. We have partial or focal seizures. We have generalized seizures. So in epilepsy, we have an abnormal electrical conduction system within the brain that happens. So now, what is partial or focal seizures? Partial seizures involve one portion of the brain. Partial seizures may progress, becoming generalized seizures. Generalized seizures. Generalized seizures may begin locally, producing abnormal electrical discharge throughout both hemispheres of the brain. Mechanism of action of anti-epileptic drugs. These drugs inhibit the neuronal discharge or its spread by altering cell permeability to ions and by enhancing the activity of natural inhibitory neurotransmitters such as GABA. Let us now look at prototype anti-epileptic drugs. So some of the drugs that can be used in epilepsy include benzodiazepines, GABA analogs. Okay, so now also phenytoin can be used. Let us look at GABA analogs. An example of GABA analog include gabapentin, that is gabapentin. Gabapentin is an analog of GABA. However, it does not act at GABA receptor nor enhance GABA action, nor it converted into GABA. Its precise mechanism of action is not necessarily known or is idiopathic. Gabapentin does not bind to plasma protein and is excreted and changed through the kidneys. Phenytoin. So now phenytoin mechanism of action. Phenytoin blocks voltage-gated sodium channels at very high concentration. Phenytoin can block voltage-dependent calcium channel also. Therapeutic use. Phenytoin is used in treatment of partial seizures and generalized seizures. Adverse effects. The side effects may include gum hypertrophy and skin rashes. There you have it. We have been looking at drugs of the central nervous system. In looking at the drugs of the central nervous system, we have also looked at some of the diseases that may affect the central nervous system. And in discussing those diseases that may affect the central nervous system, we have discussed the drugs that are used in those various diseases, and we have also discussed the mechanism of action. To understand this topic nicely, we need to appreciate the neurotransmitters, their role, and then the negative pharmacological effect that is needed for us to treat the disease. So some of the diseases that we have discussed affecting the central nervous system include neurodegenerative diseases. An example is Parkinson's disease, which is a dopamine deficiency disease, if we are to look at the neurotransmitter that is involved. Then we have looked at anxiolytics and hypnotic drugs. We have looked at Cns stimulants. We have looked at antidepressants. We have looked at neuroleptic drugs. And we have also looked at the anti-epileptic drugs. It's important to note the drugs that we discussed. We find that mostly when handling mental health patients, a lot of neuroelectric drugs are used. That is the typical and atypical. We need to establish those that have got low potence, those that have got high potence, and the ones that have been made within the new generation. So that has been our lesson on central nervous system drugs, and we are going to cover another lesson, this one on in PowerPoint, where we try to simplify some of the drugs that we have discussed here per condition. So that lesson has been covered, and I'm sure it has been now uploaded, so it will be uploaded soon, so that you can follow per disease of the central nervous system. You can follow the drugs that have been used. For now, we are just discussing in general the drugs that are used within the central nervous system, and we have discussed the conditions within that. So thank you very much for listening, and keep studying.